Hi, this is Tom Broussard. It's nice to see everybody. We're talking today, as always, about aphasia and awareness. And as I continue to study how it is that the world doesn't know much about aphasia, um, I continue to see that one of the biggest reasons is that hospitals just don't think about aphasia. I've said it before that the hospitals, the conventional hospitals, the stroke-centered hospitals, they are made to work with people with stroke, uh, save our lives, and stabilize us. And then as soon as that's ready, then they move us to another facility, usually rehab or to home. So that's basically what it does. What they haven't figured out, what they will probably never know until I try to show it to them, is that the uh, in order for the people with aphasia who are discharged understand about this disease that they have, this disorder that they have, unless somebody tells them, begins the education while you're at the hospital and you're discharged home, a lot of you will stay at home and we will never know about this thing that you have. Even if you do get a rehab, excuse me, opportunity a month or 2 or 3 months later, by then, clearly, you sort of don't understand what happened before. All that time, you're not going to understand going forward either. So yes, an awful lot has to change, and typically it has to do with the culture of the hospital system. And as I study this, of course, I find out how many different ways, how complicated it is in the hospital system. And again, I'm not pressing them. I don't want to, quote, bother them, although unfortunately I have to bother them at least a little. But really trying to educate them so they can better understand, basically break through those siloed entities so they can begin to understand, oh, this is why they should be doing this. Because if they don't do it, nobody will, because the receiving rehab facilities, they won't really know until they get a piece of paper that says, oh, you're getting somebody soon. Here's their name and number. Call them and set up an appointment. But until you get that and they actually have you in their hands, we are left in the middle, basically, in that gap, and that's where we will stay. So the that is our issue, and as we try to educate the hospitals, and of course there's three legs of that stool. One of the people with aphasia who have it but might not know, the SLPs at those hospitals, typically they're the ones who are assessing you, and maybe if they have an inpatient wing of their hospital, then they'll start to work with you doing speech therapy and obviously informing you about aphasia. What's missing, though, is that there are stroke coordinators at all of those, especially the stroke accredited hospitals, and those stroke coordinators, and they come as a result of the Joint Commission, which is the big organization that accredits all those hospitals, and there are 2,446 hospitals like that, and each one has to have a stroke coordinator. They're the ones who basically coordinate everybody in that stroke team. And they have to be accredited every three years. The stroke coordinators plays that part. They also have quarterly meetings with all the big people within the hospital and the stroke world come together and discuss how we're doing. What are we doing that we'd like to get improved by? And they happen to have a lot of power, the stroke coordinators. So we need to find the stroke coordinators as that triad of the third leg of the book. I'm sorry. Yeah, that's aphasia for you. Clearly a little tired of this stool. And so that we can start to inform the hospital through the stroke coordinators as a large part of that. And one thing I always work off of metaphors because everybody has its own silo, as it were. The hospitals have theirs, the rehab community have that. The SLPs have their own. A lot of the SLPs don't really know much about the stroke coordinators. Stroke coordinators don't know much about people with aphasia, although they do know. Each of them do know each other, but they don't really know each other. Um, and so again, bring them all together and realizing that so much of this has to do with the culture of each of those organizations. And it's incredibly difficult to change the culture. But that's where it's going to happen if we're going to make any improvement at all. You can't just go to the hospital right through the front door and say, you must do these things. Some of those things they might do if you really yell at them long enough, but really it's the culture as they begin to understand why they think they themselves should be doing these things. And one of the first steps, of course, is not only providing the educational information for the people with aphasia and their family, very important for the family because people with stroke really don't understand what's happening for those days and weeks and even months, and they need their family and other support people to help you. But the next really big step is to pull them all together and help to provide the fact that some of these things, like having the website in hospitals, often don't even have the word aphasia appear. So you're discharging people with 25 to 40% of people who have this disorder. The patient won't know about it. The hospital doesn't really think about it because they're leaving, right? So they're actually discharged having this disorder with nobody telling them about it, including anywhere on their website, anywhere in their website. So Aphasia Nation is working hard to build a database for all of those 2,000 plus hospitals, their stroke coordinators, their local SLPs, and local people with aphasia, and starting to build the cultural attack, as it were, educating all three of us, and then moving on and joining, making a proposal to the quarterly steering committees that the stroke coordinators provide, and then making that presentation to all the rest of the officers and the people at the hospital to say, this is what we should be doing, something you ought to be thinking about, given that you have all these people with aphasia and they're not educated by the staff or by the people to whom you are discharging them to. As I talk about the culture of all this, I love the metaphor of curling. For those of you who know about curling, you know what that is, with that big stone, and sweeping, because it's amazing that they really do launch those big stones. And the only way to get to the other side and to come closer to their target is to sweep, as you've seen, and actually see that picture in the article. And it's all about the sweeping, so that the culture of that stone can't be touched. You can't push it one way or the other. You can only launch it, and it starts. And once it's gone, it has the momentum, the inertia, and it will continue to move in a certain direction. Not unlike the culture of a hospital. Boy, it has been launched, and it's going to go, and it's going to go in a pretty much certain direction. And unless you can alter that, you can't really change it much, but you can alter it by altering the environment, by the education of all those people inside of those hospitals. Then they too can begin to, quote, change the direction of their particular cultural stone. So it's all about the sweeping. It's all about changing the culture by changing and educating that environment around them. Just like that, the sweeping, when they actually create a little bit of ice on top of the ice, a little bit of slippery water, and as a result, because of all that sweeping, the stone will be drawn that direction. It hasn't been pushed, but it be drawn that way. And that's what I always like to say, that the curling stone, when it comes to cultural change, it's really how it's just drawn that way. So all three the SLPs, the people with aphasia, as well as the stroke coordinators, all have to come together to start this process of changing, quote, the culture of a hospital such that they will move, they'll be drawn in a certain direction without, quote, being told, or you must do this, you must do that, and move it from here to there. We do that in business a lot. We're really good within those silos, but outside those silos, we have a really difficult time coming to understand what otherwise we just don't understand because we're not really built that way. So that is what we are doing now. I use this metaphor because it's a really, really good understanding of how this is going to work. There's one of me. There's a couple other people who are working on this. There are thousands of hospitals, millions of people with aphasia. I think there's a lot of inertia that can be brought to bear by these millions of people with aphasia, as long as we can get the word out about why it's so important to change the culture of the hospitals. Not because they've done anything bad. The hospitals have done very good at what they do. So do the rehab facilities. But it is really the gap in between when discharged with aphasia and not understanding it, and sitting in that gap waiting for somebody else to show up and start to tell us when we ought to be told about that much, much earlier. And although we do talk about the website as sort of the first step, because that's something all of us can see. We're looking at it here. We do this on a regular basis as we're building up that database, and you get to see lots and lots of hospitals that are primary hospitals, the comprehensive hospitals, and they do not have the word aphasia anywhere in their website. That means that their own people there, their own patients there, do not understand what this thing is, which obviously, like myself and so many of the rest of us, we really have no idea, and it takes a long, long time to figure that out. So as we are working on it, like I said, it isn't just the email, but we're asking, do they provide more information, materials, educational materials to their family, if not to the person with stroke and aphasia themselves? And I don't mean just give them a piece of paper or two. I mean, that's what I got, and I couldn't even read it, but my wife did, and we saved that one piece of paper. That isn't enough. You have to give more information. As I say, as you see there, the ABCs is the only book. This is the only book that should be provided to every single person with stroke and aphasia at the hospital, because then the family can start to read what I otherwise couldn't. And when you're discharged, if you receive nothing else, at least you have that when you go home. And even then, for all the other factors that keep you from going to rehab or not, at least you have that in your hand and can begin to understand why this is so important. If you just get pieces of paper, they will be lost. If you give them a book, they will not be lost. So we have to go from the emails, we have to go to the website, make sure that there's information on their website. You have to have educational materials while there. Also information when you are discharged, because many hospitals do provide discharge materials, a lot about stroke, nothing about aphasia. So even the family gets these packets, these booklets, and they read it, and it says, oh, sure, I know everything about stroke, what I should do to prevent another one. Nothing about aphasia or what's going to happen with this now marathon that is required to improve one's language. So, and then ending, of course, with the education of the community, because again, if you have 1 million people in your city, or even 100,000, and you have a certain large number of people have stroke and aphasia, the community also won't know much about it either. And since you can't go to the website to find out because it's not there, they really have no idea why they're talking about a particular person with stroke and aphasia, other than what they might see in the press about various people, stars, political people and Hollywood people who happen to have aphasia. But again, it takes a lot more than just hearing from one person or another that you have this particular disorder. And even the press isn't terribly good at explaining exactly what these different kinds of aphasia are. So this is the issue. And as I say here, sweeping cultural change of the healthcare community and aphasia is the next step. Thank you very much. Please give it some time to listen to these articles, these presentations, read the articles, and continue to join Aphasia Nation as we try to make the appropriate changes in the environment that can help draw people to understand an awful lot more about aphasia. Thanks again. Have a good week, and I'll be talking to you soon. Take care. Bye-bye.